So I have to talk a little bit about, okay. I have to talk a little bit about heart disease. Now, for some of you who don't watch a whole lot of reality TV, there's a program called Basketball Wives that comes on VH1, and it's basically women who were engaged to, dated, or had a baby with a basketball player. And there are some basketball players' wives, but that tends to not be where they're coming from on this. So let me play a little clip, and then we'll talk about Tammy and how she ended up having this minor heart attack here.
It's serious. I wasn't trying to be cute. I'm appreciative of the situation. That's it. What I'm saying is, don't try to be coming at me talking about
okay,
that,
that's
right?
Tammy.
No, bitch, that was specific to me. Talking about all the way from food stamps, right, Tammy?
I'm saying
bitch, I know where I came from, but you need to understand where the you came from. So don't let me start telling your bitch.
So shut the up and say what you're saying.
Well, as you can see. As you can see, it's a very vibrant program with tons of cussing, tons of arguments. And the problem here is that stress is one of the #1 ways that you can have a heart attack. Actually, they've even had people who've had heart attacks just based off of a love lost or just being scared to death. So stress is a #1 cause of heart attacks in women. So I want you to think about this. We hear a lot about breast cancer. They talk about breast cancer awareness. We wear the ribbons. But really, heart disease is the #1 killer of women in the United States of America, period. So the risk factors include, but are not limited to, family history of heart disease, smoking, if you've had any drug use, which Tammy allegedly used to have some drug problems, so that could have weakened her heart too. Just a diet that's racked in high cholesterol, blood pressure problems, and this thing we call metabolic syndrome. Now, if you are like everybody else in the summertime, you maybe have this little bit of an inner tube around here, and you're like, how can I lose that? Well, besides wanting to look cute in a bikini, you really need to think about losing it, because that little area, coupled with high cholesterol, puts you in the category of having metabolic syndrome, and if your blood pressure is a little high too. So metabolic syndrome actually increases the risk that you might have a heart attack or heart disease in the future. And so, if you watch the show, you'll notice Tammy's weight fluctuates up and down, and every time we see her, she's actually eating, and sometimes even eating ranch dressing. We all love ranch. But if you look at the bottle of your favorite ranch, you'll notice that it's loaded with cholesterol, fat, and calories. So we're coupling stress, road rage, being angry, having a poor diet, low exercise capacity, smoking cigarettes, and a past history of drug abuse. And this could happen to any 41-year-old in America. So I caution you all, it seems like around us people are having these heart attacks, and you're like, they're so young. Well, at the end of the day, if you don't take care of yourself, these are the types of things that we'll have to look forward to early. So if you start now, we won't have to worry about these things later in life. Now, the headline said she had a minor heart attack. So what is a minor heart attack? Basically, when you have a heart attack, what's really happening is the blood flow to your heart isn't getting there. So however that's happening, it can happen in a small degree, or it can happen in a large degree, meaning that it can be one vessel that's blocked off or a couple vessels that are blocked off. And so at the end of the day, that's how you end up having a heart attack. And what ends up happening is the tissue, muscles need oxygen and blood flow to survive. And when it's not getting the right amount of blood flow, the muscle tissue starts to die and get weak. So if you have high blood pressure, if you have high cholesterol, these are the types of things you need to take very seriously and follow up with your doctor and follow their prescribed diet and their medication regime. So our hearts and prayers are with Tammy as she recovers from this heart attack. And my love and prayers are with you all too, because I want to make sure that we use this as a sign that, one, stressful events, having a stressful life and not eating right can actually take you out of here early. Luckily, Tammy's still with us, so we want to keep that momentum going, okay? Now, my